Good evening. Today is the 22nd of September 2022, and welcome to Illawarra Court for this press conference, which is being hosted by the Acting Prime Minister, the Honourable Cynthia Bradshaw. Joining the Prime Minister this evening will be the Attorney General, the Honourable Dale Marshall, Minister of Tourism and International Transport, Senator Lisa Cummins, and the Acting Chief Medical Officer, Dr. Anton Bess. Joining us also this afternoon will be members of the media who will be invited to field their questions to the panel following the presentation from the Acting Prime Minister. I'll turn it over to the Prime Minister. Madam.
Thank you so much, Alex. Good afternoon, Barbadians, and good afternoon, friends of Barbados. It is my pleasure to address you today and to say at the outset, thank you for staying true to who we are as Barbadians. I say this because when we pause and we consider the path that we've traveled as a nation since the beginning of 2021, it would be hard to find another period in our modern history that has tested us in the way that COVID-19 has. As a people, we've had to make some decisions, endure hardships, and alter our way of life in order to survive. And certainly every decision which we have made as a government would not have been met with the agreement of everyone. But we all saw the need for a united approach, and we have acted as one. And that's why I begin in this way, and that's why I want to say a thank you to all Barbadians who have been rising to the occasion in this fight against COVID-19. Despite all that we have been through, we did not retreat, we did not surrender. Yes, we may have become a little battered and bruised along the way, and we lost many friends, many family members, as well as we fought this struggle with COVID. I know that we are also all a little COVID fatigued as well, and we are now at the point where we can really make some fundamental changes as we strive to turn the corner at this latest phase in our management of the COVID-19 pandemic. I am sure that, like many of you, we've all been noticing the sustained trends in the COVID-19 statistics. In every instance, our numbers are down considerably, providing us with much needed breathing space, both literally and figuratively. Today's positivity rate is at 12%, and 4 weeks ago, it was at a staggering 26%. Consequently, the Cabinet of Barbados that met today has looked carefully at all of the evidence as well as the trends locally and internationally. And more countries we've seen relaxing mask wearing, some even totally removing them. Many have relaxed or eliminated the travel entry protocols, and across the globe, generally the fear of COVID is nowhere near what it was when we first started in this pandemic. Wherever you go today, people have come to the realization that COVID is now a part of their daily existence, and they are learning to live with it. And in Barbados, we are no different. Given this and the advice of the EOC, the Emergency Operations Committee, which comprises our public health officials, the Cabinet of Barbados met today and approved a number of fundamental changes to the COVID-19 directives that have governed our management of the pandemic since early 2021. I can now announce, therefore, that effective tomorrow, Friday, September 23rd, 2022, the following will be obtained. The wearing of masks generally will now be optional. However, mask wearing remains mandatory for persons in nursing homes, private hospitals and senior citizens' homes, persons in healthcare institutions, including staff, visitors, clients, and patients, all institutions where medical and dental services are provided, persons in prison, including staff, prisoners, and visitors, staff and students at all educational institutions, all nurseries and daycare facilities for both children and adults, and of course persons who have COVID-19, as well as persons who are traveling on public transportation. I believe, however, that it is critically important that I make this point, that individuals who are at increased risk for illness or death due to COVID-19, particularly the elderly and those with health conditions, may find it prudent to continue wearing masks around others. Similarly, those who have come into close contact with such vulnerable persons and you're encouraged to wear masks and to practice good hand and respiratory hygiene. I want to take this opportunity as well to encourage you to make use of the available COVID-19 vaccinations and the boosters that provide yet but another layer of protection against the virus. In other words, simply because we are removing the mask mandate does not mean that you still do not provide yourself with an extra layer of protection. Barbadians, my message is therefore very simple, that while it is now possible for the majority of us to relax, there is still a considerable number of vulnerable citizens who suffer illness or death if we act irresponsibly. In other words, your grandparents and your elderly family members, your parents as well, may be in the home with you. And therefore, while we are all excited to be able to now not have to wear masks, I encourage you to enjoy your freedom, but at the same time, with these relaxed protocols, let us not stop being our brother's keeper. Members of the public are also reminded that if they are COVID-19 positive and in isolation, they need to be wearing their masks. And they need to be wearing their masks, particularly because they are infected, and they need to continue to do so for 3 days after the mandatory 7-day isolation period. Conscious of the direction in which the rest of the world is going as well, effective tomorrow, we will also discontinue all COVID-19 related travel protocols for Barbados. This means that we will be joining 95% of the countries in the Western Hemisphere who preceded Barbados in going in this direction. There will therefore be no testing requirements for entering Barbados, whether you are vaccinated or unvaccinated. It is because of the cooperation of Barbadians that has brought us to this point where we can safely open our borders without such entry requirements. And I therefore again want to say thank you to Barbadians. I know it has not been an easy ride, yet you have stuck with us. You heard the former Minister of Health indicate to the country that we would not retreat or surrender. That is the position that the government has taken. I think that is what has been embedded in the minds of all Barbadians, that we will not just succumb to this illness. And therefore, I want to again say thank you to Barbadians and to ask you to continue to work with us as a government and certainly the medical officials to be able to get us through this period. Before I close, though, let me reiterate that the Ministry of Health and Wellness and the Government of Barbados encourages all Barbadians and visitors to our shores to recognize that the importance of exercising personal responsibility is really for their own protection and the protection of others from COVID-19. The stage we have reached, and as I said at the start, provides us with some breathing room. It does not say, and we do not suggest, that COVID-19 has been eradicated from our island. We're not saying that at all this afternoon, because we are well aware that COVID-19 is alive and well. The length of time it takes to record 0 new cases will be influenced by how effectively each of us exercises personal responsibility in our behavior. And I therefore, along with my colleagues here this evening, I have with me the Attorney General, as you heard before. I have the Minister of Tourism and also the Acting CMO, Mr. Anton Bess, as well, with me here to take your questions that you may have in relation to the protocols. Let me also apologize for the absence of the Substantive Minister of Health, who is away on government business. Acting in his stead, obviously, is Dr. Sonia Brown, who is also here with us as well. And I therefore will want to open the floor for any questions that you may have at this point in time.
And she bemoaned the still unsatisfactory level of vaccination in the Caribbean. We are about 59% of our entire population now vaccinated. Is there anything the Ministry of Health and Wellness can do now to get more Barbadians to be vaccinated, or are we at the stage now where our vaccination has plateaued to the point that we will not really see more adult Barbadians coming forward for vaccination against COVID-19?
All right, thank you. Thank you very much for the question. It's a very good question. Essentially, you're asking about the stagnated rates of the COVID vaccine program in terms of the proportion of adults in Barbados who are fully vaccinated. So right now we're at 57%. If you check just 2 days ago, we were at 56.9%. So we're creeping up very slowly. And unfortunately, the numbers of persons coming forward to be vaccinated and boosted is very low. Fortunately, somewhat, when we compare what we're seeing in Barbados to the rest of the region, we are above the regional average, but still we're not where we ought to be and where we could be. But I think the question that you're asking, I could really fire back at you, because it's something that we've all been talking about from the time the vaccine program started 18 months ago. We need to encourage people to be vaccinated. We need to encourage people to not pay attention to the disinformation and misinformation out there and get the facts. Rely on the Ministry of Health and Wellness for reliable information. Rely on agencies such as PAHO, the World Health Organization, the U.S. Centers for Disease Control and Prevention, for reliable information on the effectiveness and the safety of the vaccines for COVID. So the vaccines for COVID are mainly, the greatest utility for the vaccines, as you all know, is to reduce the likelihood of death and severe illness. That still obtains even in an Omicron environment. So the Ministry of Health continues the vaccine program. We continue to find new strategies. We've partnered with many agencies, such as the same PAHO. We've recently completed a project with the IDB, the results of which are going to be officially, the outcomes of which are going to be officially presented to the government of Barbados within the next few days. And there are many other partners, many other strategies that we are employing to find creative ways to get people to be vaccinated against COVID. It really relies on all of us having an understanding of the benefits of it, encouraging our families, our friends, our children, our parents, our siblings, and simply having the correct information, because we believe that the relatively low vaccination rates are due to a lot of the misinformation which is causing vaccine hesitancy.
Thank you, Dr. Best.
It's a great question, but understand that the response is the solution rather, is very complex and it requires a multi-pronged strategy.
And a follow-up question quickly. Last year, Dr. Elizabeth Ferdinand, one of the core coordinators of our vaccination program, she had mentioned the need for a governmental approach to a deep dive into long COVID. Now that we are at this stage of dealing with the pandemic, can you say if that deep dive into long COVID, the research into it, has started, or will you expect it to start in the very near future?
Yeah, so Barry, another good question. The deep dive that Dr. Ferdinand would have been referring to may have been on the government's end in terms of understanding what long COVID is, or what we now call post-COVID condition in Barbados, and doing something about it. So we in the Ministry of Health have started. We've had internal discussions. We've met with BAM on the issue. We've actually developed a program that is yet to be finalized and presented to the Cabinet on what it is we're going to be doing for post-COVID. One thing I need to say is that the world doesn't understand everything about post-COVID condition. So essentially, somebody has COVID, and because of the generalized inflammatory process in the body, so persons who are hypertensive are getting problems with their hypertension. Persons who are diabetic, or persons who are pre-diabetic or not even known to be diabetic, are coming forward with diabetes. So it's touching on all different medical specialties. We're seeing a whole host of complications of COVID. And tying it back to your question, that's one of the benefits of the vaccine from my understanding. But appreciate that the level of understanding that we have is growing. There's a lot of new knowledge that's coming in every single day about post-COVID condition. So we will continue to pay attention to what the WHO is recommending, what the World Health Organization is recommending, and other health agencies as we learn more about post-COVID condition.
Trevor from CBC News.
Sure.
Does the relaxation? Trevor from CBC News. Yes, Dr. Best, Trevor Thorpe, CBC News. With the further relaxation, things like bus crawls and award ceremonies are now open to business?
Absolutely.
Without, in respect of numbers, there's no head count or moratorium on numbers per se? that we had before?
I think I would deflect that question to the Attorney General who's on the panel. What I can say from a public health perspective is we're on the path of normalcy, but we're not back to the 2019 situation because we still have COVID. This is a marathon of the 26 miles plus in a marathon. We can see the finish line, but we're not there yet. So that is why we are constantly relaxing protocols, but it can't be business as usual completely as we did at the end of 2019. But the Attorney General is the best person to answer the question in terms of the law.
Well, more important than the law is the background reasoning to how we approach the directives. But I think, Trevor, that you would have seen, and you would have been with us, all of you would have been with us from the beginning, back in March of 2020, when you had a very restrictive regime. And as we progressed through COVID, we had to tighten those restrictions to the point where we had to abolish bus crawls and so on. Obviously, the Ministry of Health and the Chief Medical Office and his Chief Medical Officer and his staff inform and advise Cabinet on what form the regulations should take. So it's not a case where the Attorney General's Office or Cabinet makes specific decisions on rules and regulations without the input of the CMO. The relaxation process is continued, and so today we have an environment that is, there are still some restrictions, but it is actually a lot freer than before. So in terms of numbers, that is no longer, limitations on numbers is no longer relevant because we've removed the physical distancing requirement. We are making, as the Prime Minister has said, we're making wearing of masks in spaces optional. So today, because we are bound by the law, we have our masks. But as of midnight tonight, we can gather in Elara Court, gather in Parliament, anywhere at all of that kind, and not be required to wear a mask. So I understand there's a visceral almost feeling that if people can gather in large numbers, then there's a risk. But I think that we've come a long way, and the Ministry of Health is satisfied that at this point we are able to ease the restrictions on Barbadians. But be mindful too that Prime Minister Motley has always said that when the time comes for us to mash brakes, we will do so. At this point, we still have a state of emergency in play, and we feel comfortable as a cabinet. Cabinet supported these particular measures today, so we feel comfortable that the advice that we're getting from CMO is the best advice that we should follow. So what we reflect in the directions comes from the guidance they give us, and at this point we don't feel there's a need to have any restrictions in terms of numbers and things of that sort.
General, should there be, God forbid, a spike, then there is a provision that you can, based on what you just said, there's something there to put in place to pull back.
As I said, the state of emergency still continues. Parliament, when it last met earlier this month, agreed to extend the state of emergency until the 21st of December. And that gives us a legal and regulatory framework to make adjustments. We've been adjusting downwards in terms of the level of restrictions on Barbadians, but if necessary, there's all of the legal powers that were here from March of 2020, those are still available to us. So on the advice of the CMO, if it is necessary, we do have the opportunity to tighten things again.
I have a question for Dr. Bess. Dr. Bess, a few weeks ago, Dr. George would have given us an update on monkeypox, but I'm sure, as you would understand, since then thousands of people would have come through our borders. Can you tell us now if the ministry has had any more people present symptomatic of monkeypox, and if so, have you done any additional sequencing to deal with that virus? We are living in a world that is a pandemic world, and we're not only dealing with COVID-19, we are also dealing with monkeypox. Can you give the country an update regarding monkeypox? Thank you.
Yeah. So the question is, in essence, have we continued the surveillance for monkeypox at our ports of entry? Obviously, monkeypox was not in Barbados until we had that one case, and surveillance at the ports of entry is very important, sensitizing the public about monkeypox, what to look for, who's most at risk, etc., is part of the surveillance that is ongoing. We have had additional suspected cases in the last few weeks. All of the tests which are now being done at the Besto Sanders Public Health Laboratory have been negative. So barring that one case, so we've only had that one case of monkeypox in Barbados, and all the other tests have been negative, no further cases of monkeypox.
Could you tell us, though, how many suspected cases there were approximately?
I don't have that information.
Okay, thank you.
Hi, good evening. I'm Shamar Abdullah from Barbados today. My question is for Dr. Best. Dr. Best, obviously, schools would have resumed this week to full capacity, obviously, compared to previous months. Obviously, even before that, you've had a call for children to come forward who are under 12 years old to get the COVID vaccine. Can you give us an update on how the numbers have been going? Is the Ministry of Health pleased with the numbers that have been coming forward? Just give us an update on that.
Okay, so you're asking about the vaccine for children 12 and older? Because okay, I thought you said older, because the vaccine that we recently introduced is the Pfizer-BioNTech vaccine for the pediatric population, children between the ages of 5 and 11. I don't have the numbers for that. I can tell you that the numbers are not as high as we would like, so we continue to encourage parents and guardians to bring their children forward to be vaccinated against COVID-19, because we have access to the pediatric vaccine. We have it here in Barbados.
Can you tell us if the status quo will remain as it relates to vaccination centers? Because as our numbers have plateaued, will we keep the same amount of vaccination centers open? These centers use up resources, use up staff, etc. Are we going to now centralize it where the additional Barbadians that want to come now, if they will come one place, say, for instance, Scott or Bradford Tate Polyclinic?
So when we started the vaccine program in February of last year, it was necessary for us to have additional sites for persons to come and get vaccinated. We had multiple additional sites. We used church halls, community centers, and we had to do that simply because we needed to avoid the crowding that would have occurred in the polyclinics given the numbers of persons that were coming forward to be vaccinated. However, in the last few months, we've had to whittle that access down simply because the demand isn't there. So at this current point in time, I believe it's only a handful, probably one or two additional sites where you can get vaccines outside of the polyclinics. So another part of the question is, or another way I'd like to answer the question, is to say that we are merging the COVID vaccine program into the EPI, the expanded program for immunization, which is the regular vaccine program for children, but then it also includes vaccines for adults who are traveling, influenza, the seasonal influenza vaccine, pneumococcal vaccine, etc. So we are on the path for doing that. That is the only thing that makes sense. A lot of the clinics have done that. Some of the larger clinics, some of the busier clinics have not yet done that, but certainly within the next few months we will get there where that vaccine, the COVID vaccine program, is fully integrated into the clinics.
Just a follow-up question for that too is, yesterday Dr. Etienne expressed in some ways shock at the amount of polio that had resurfaced in the North American hemisphere. Can you explain to us if the Ministry of Health and Wellness has similar concerns when you look at what our EPI has done for the last 3 decades? Does the ministry share that concern about polio?
Absolutely. So we share the concern about vaccine preventable illnesses because the coverage for vaccines has dipped below the 95% coverage benchmark that we want. So in essence, we want 95% of children who are eligible to be vaccinated for vaccine preventable illnesses to be vaccinated. When we look at the measles vaccine, for instance, in MMR, we were at 85% in 2020, and we dropped to 76%. So this happened, some of this happened before COVID, before the COVID pandemic, before the vaccine hesitancy associated with the COVID vaccine. So not all can be attributed to COVID. I don't know if that's where your question may head, but I know it's something that persons have been discussing, and the media, some media houses have been asking, is the hesitancy related to the COVID vaccine leading to vaccine hesitancy? Answering your question specifically about polio, Barbados, like other countries in the region, remain concerned because we do have vulnerable populations within our community, and it goes beyond polio. Measles, for instance, extremely contagious. When you drop below that 95% mark, you have vulnerable children and vulnerable people in your population. 95% mark for polio especially is the herd immunity level.
What can the ministry do, however, to get it from 85 back to the
So this is something that didn't start yesterday, didn't start last month. This is something that's ongoing. We have consistently tried to implement strategies to get to that 95% coverage. So we continue access to the vaccines within the polyclinics. We go into the schools to vaccinate the young kids. We look for new strategies and new ways to encourage parents to bring their kids forward to be vaccinated against these diseases.
Dr. Best, would it be a fair assumption that in recent times Barbados has become a vaccination reluctant society? And if you feel that way, I mean, what can we do from a public health perspective really to change that?
All right, so let me say that we are recognizing that there is greater vaccine hesitancy in Barbados. I don't want to label Barbados as a vaccine reluctant society, but certainly vaccine hesitancy is increasing in Barbados. It is a concern for us, as it is across the region and globally. Next time I see you, I'll make sure not to remain here. But I'm accustomed, Barry. I'm accustomed.
But just to say, Barry, I think that we have still done exceptionally well in considering, obviously the government has expended significant resources during this pandemic. We've built out the hospital, which now is no doubt going to be able to help us not just in the fight for COVID, but also beyond COVID. We put school monitors in our schools to make sure that the schools were safe. That obviously will continue for now. And we have basically done all we could to make sure that we had the vaccinations. And, you know, it's interesting when we sit at this end now, when we can talk about removing these mandates and stuff at this point. But we have really come a long way as a country to get to this point. There's been no precedent, and AG would be very familiar with the word precedent. There's been no precedent. There's been no playbook from which we could really manage the affairs of a pandemic because we've never been through it before. But I think that today, in making this announcement, I think it's an acknowledgement as to the collective efforts that have been made by the government, as along with the private sector, along with the general public, the nurses, the doctors, all of the stakeholders have risen to the occasion. It may not have been an easy road at every juncture that we went along, but the truth is that we are here today able to make some additional decisions to bring some relaxation to the COVID-19 directive and the protocols. But we still want Barbadians to exercise that personal responsibility. They have to take responsibility for their own actions. And I can't reiterate enough, if you have an elderly person in the household or a child that is vulnerable, it is your responsibility to make sure that you protect them. And by so doing, it means that you have to take responsibility for where you go, when you go there, whether you're wearing a mask, whether you take off the mask. That hasn't changed. But the truth is that we're seeing, especially if you travel, you're seeing all across the globe, region, that there has been a relaxation of these measures, and it is because we have all globally been able to cope a lot better with our understanding of the pandemic, and making sure we still sanitize. And so I hope that the public understands and appreciates that journey, because it is very, very easy to forget the road that we have traveled, and to say that we are not over COVID completely. It is still very much alive and well. But we all have a responsibility to remain in this together. And I'm sure that if anything changes over the next few weeks and months, that yet again, health will provide that support and that guidance to through the EOC, to the Cabinet of Barbados, to Prime Minister Motley, and to all of us, to be able to help us to make decisions that are in the best interest of the country. And so I just want to say thank you again to the media, because without you, in terms of spreading the message and trying to maintain that balance, we would not have been able to get to this point either. And I hope that the narrative as we go forward is that this country has not retreated, it has not surrendered, and that we have come out of and will come out of COVID a lot stronger and more resilient as a people as well. So again, thank you to all of you. Trevor. Sure.
Madam Deputy Prime Minister, I have one for Minister Cummings, because with the new protocols and the BHTA is on its 70th anniversary, you've got a lot of things are happening. What is the new plan with this new arrangement?
Thanks, Trevor. I think certainly the acting Prime Minister made mention of it earlier. Barbados is in the minority of countries, about 95%. There were 5 countries remaining anywhere in the hemisphere that had restrictions in place for COVID in terms of travel restrictions. And so clearly the entire hemisphere has gone in the direction of removing travel protocols in order to allow for some level of normalcy to return. And so Barbados is now at a stage where there are some things on which we're not afraid to lead. There are some things where Barbados is quite comfortable being the first. In this instance, Barbados was comfortable taking a little bit longer than many of our counterparts in removing the restrictions in order to ensure that we kept our local population safe. But having done so, I certainly know that for the tourism community, the industry partners, the policymakers, this is going to be a significant boost to our winter season, which is upcoming, because many of the people who are coming from our major source markets are themselves living in countries where these restrictions have been long removed and they're no longer in place except in certain limited circumstances, including some of the instances that were mentioned earlier by the Prime Minister and by the Attorney General. And so it allows for a seamless transition for visitors from their home countries to here in Barbados, while at the same time encouraging people to make individual and personal responsible choices. If I'm uncomfortable in my space, if I feel as though I'm in a room where there are more people than I may be comfortable with, or I feel as though I'm symptomatic, I may wear my mask. And that's a personal choice that we will each make, both here and when we travel and when visitors come here as well.
Plan B from your ministry to be rolled out on Monday, having know that you've got this, you had a Plan B sitting on to roll it on Monday?
I don't know what you mean, Trevor, but there is a directive that comes into effect at midnight tonight. So that's Plan A that's going to come into effect. So our PR teams are already fully lined up. Our source markets are fully lined up. All of our travel partners will be communicated with within the next couple of hours, and that communication has already begun while we have been sitting here. So we are moving forward with the regulations as have been outlined by the Prime Minister and further detailed by the Attorney General.
Thank you, Trevor, and again, thanks to the entire team for facilitating the press conference. Alex?
Thank you so much, Madam PM, and thank you to the Attorney General, the Minister of Tourism and International Transport, and also thank you to the Acting Chief Medical Officer for sharing with us here on these matters of national importance. I'd also like to say thank you to the members of the media who have fielded questions and the members of the public who have tuned in and joined us this evening. So I bid you a good evening, be blessed, and be safe.